today's talk, and it's a windy Friday evening, the 26th of November. Now, you're probably aware there's some pretty serious news today. There's been a special meeting of the World Health Organization, and we've known about this for a few days. But the World Health Organization have just made this press release here, classification of Omicron. This is the new variant that's been discovered, the B11529 variant of concern, now classified as a variant of concern. And we've known about this for a few days now, and it is looking like it could be an issue now. Let's look at why this could be an issue. Is it the worst ever COVID variant, Omicron? Well, I'm afraid it could be for some reasons. Now, what we're always worried about, of course, is the three things. Is there increased contagion? Is there immune escape? In other words, the people that have been vaccinated, can they now get it? Will they lose the protection from the vaccine? And people that have had the natural infection, will they lose protection? And is it going to make people sicker? Is it more pathogenic? These are always the questions we need to look at. Now, so far, the data does seem to indicate that Omicron is more contagious. It's looking that way. Immune escape, it's looking that way, albeit with a smaller tick. We're less sure about that. So it looks like we're pretty sure about this one. Less sure about this, but it looks like I think we have to say it's a probability rather than a possibility. And does it make people sicker? We have no idea about that at the moment. No data either way at all on that. So this is what we know and what we don't know. Now let's look briefly at what the World Health Organization has said first of all. Now this is from the Technical Advisory Group on SARS-CoV-2 viral evolution, because the virus is mutating and changing all the time. As far as I understand it, they are a fully independent group of experts. This new Omicron variation was first reported to the World Health Organization from South Africa on the 24th of November. So it's only 2 days ago that it was first reported to the WHO. So this is pretty new stuff. But it was on the go a little bit before that, as we'll see. South Africa, infections have increased steeply, coinciding with the detection of the B11529 Omicron variant. Now let's just have a look at this in terms of graphics. Now here's our usual orientation graphic, and at first glance you think, well, what's all the fuss about? Look at South Africa. Hardly any cases at all way down the bottom there. And that's true at the moment. The cases are very low, but there's been a slight uptick in cases. But of course, one of the things to remember is that South Africa is heading into summer now. It's in the southern hemisphere. So the weather there is now getting better. So you'd expect cases to go down. But we do have this slight increase in cases. Then New Zealand, Australia, Canada, United States, United Kingdom, Ireland, similar rates to Germany, going quite up quite steeply, unfortunately. Moving on to South Africa itself. Now, this is on a much smaller scale, of course, but what we do see is the dot from that day to that day is much smaller. So we do see a rapid increase over the past 1, 2, 3, 4, 5, 6, 7 or 8 days, really. There's been a rapid increase in South Africa in terms of number of cases. And as we said, this is not what we would expect this time of year. We would expect the cases to be going down as South Africa head into their summer. So South Africa infections have been increasing steeply, coinciding, it's a temporal correlation, it doesn't show its cause, but with the detection of the new variant. First known confirmed Omicron variant was from a specimen collected on the 9th of November 2021 in Botswana, actually. Preliminary evidence suggests an increased risk of infection with this variant, so the WHO are agreeing it looks like there's an increased risk of infectivity. Now, the background here is the previous variant in South Africa, of course, was mostly the Delta variant, so it looks like this variant is outcompeting the Delta variant, which outcompeted the Alpha variant. And the Delta variant also outcompeted the original South Africa variant, the Beta variant. And of course, the Delta variant outcompeted the original wild-type variant. Now it seems the Omicron variant is outcompeting the Delta variant. So pretty contagious by the looks of it. The number of cases of this variant appear to be increasing in almost all provinces of South Africa, so this is all over South Africa. Now, current SARS coronavirus 2 PCR diagnostics continue to detect the variant. Now, the reason we know this is they haven't done, although they've done some sequencing, it can be detected from a normal PCR test. For the most widely used test, actually, one of the 3 target genes is not detected. So you would get a positive on one gene, a positive on the other gene, and one wouldn't be detected, and that would indicate it's the Omicron variant. It's called S gene dropout or the S gene target failure. So the S gene is not detected, indicating it's the Omicron variant. And this variant may have a growth advantage. Well, we're pretty sure it does, unfortunately, as that South Africa provisional data would tend to indicate. And even though the numbers are low, it's the doubling times, of course, that we are concerned about, because we are talking about exponential growth. World Health Organization advises individuals to carry on taking their own measures, wearing well-fitting masks, hand hygiene, physical distancing, improve ventilation in indoor spaces, massively important, pretty well ignored in the first 2 waves. Avoiding crowded spaces and getting vaccinated is the World Health Organization advice. So how come we've got a new variant all of a sudden when we've had the Delta variant for, 6-7 months now, longer? Well, we don't really know the answer to that question, but it looks like it may have come from one infected person, possibly from one infected person. Now, how could so many mutations, about 32 mutations compared to the original type variant, all occur in one individual? Well, this is Professor Francis Balu, Computer Biology Systems, University of London, his theory. Mutated during a chronic infection of a person whose immune system was already weakened by an untreated HIV infection. In other words, what he's saying here is that someone with HIV who's not being properly treated for HIV was infected, and the virus started multiplying in their body. Now, the immune system for this immunocompromised person was able to produce some antibodies, and that got rid of some of the virus. But because there was only a very small antibody response in this immunocompromised person, that means there was some viral particles left. And of course, the ones that weren't neutralized by his antibodies were the ones which would be immune to the antibodies. So there would be an immune escape. Then this process would happen again, and those ones would be, again, selecting for the most antibody-resistant strains. So these would be, it's a self-selecting evolutionary process within one individual. Then that one individual would start shedding the highly mutated virus. So that looks like how this happened, just in one individual, not vaccinated, we would assume, and not treated with a highly effective antiretroviral therapy, which of course is now available for HIV. Botswana was actually the first case, just north of South Africa, of course, discovered on November the 11th, specimen collected on the 9th of November. South Africa now 77 confirmed cases, 90% of new cases in Gauteng province, that's the Johannesburg area, are probably this variant. So about 90% of cases already. Now, if that's the case, that means this is taken over from the Delta variant. Already 90% of cases. And that means it's taken over from the Delta variant, presumably in the last couple of weeks. So that gives us a replacement of the Delta variant in a couple of weeks. Now, if this is true, what this means is this is the new variant that will now take over the world. This will now become the dominant variant for the pandemic. Now, the travel restrictions are going to slow it down, which is good because we need time to learn more about it, possibly to tweak vaccines. We want to slow it down as much as we can. But eventually that's going to spread around the world. If it is that much more contagious, this is going to spread around the world. That means I'm going to be exposed to the Omicron variation. You are almost certainly. What we have to do is be as well prepared for that as possible. And as far as we know, this is the case. So this is. I don't want to be alarmist about this, but this is quite a big thing. Early signs of rapid spread in Guangdong province, 900 cases per day. So it is taking off in that area. And as we said, the other 8, I think it's 8, is there 9 provinces in South Africa altogether? I forget. May have spread to 8 other provinces in South Africa. Yeah, I think so. South Africa, fully vaccinated proportion is 24%. Very low. And that has allowed this to spread rapidly, we believe, because the vaccines will give some protection against this. It's just a case of how much. Now, the question is when this variant arrives, as it will, in a highly vaccinated country, such as the United Kingdom, Germany, Canada, the United States, relatively high vaccinated country, what will happen there? So we know it spreads rapidly through a country with 24% full vaccination rate. We don't know what's going to happen when it hits a highly vaccinated country. But if it's got immune escape, that means it probably will spread throughout that country. Now, one glimmer of hope here is if this turns out to be highly contagious, but it turns out it makes people a lot less sick, then this could be a really good thing. Because it would go around the world, everyone would catch it, everyone would develop herd immunity, and if it's not making anyone sick, then that would be brilliant. But of course, we don't know that yet. We do not know if the pathogenicity is the same, slightly less, a lot less, massively less, the same, slightly more, a lot more, one heck of a lot more. We simply don't know that yet. Looking at how other countries have responded and reacted, Israel, one returnee from Malawi. So we can add Malawi to the list of infection countries who got this, coming from Malawi to Israel. 2 other people have suspected having the variant are also in quarantine. So that's a total of 3 cases in Israel at the moment, all in quarantine, and all 3 were fully vaccinated. How sick they are, we don't know. As far as we know, we haven't heard that they're particularly sick. We haven't heard that they're hospitalised. Let's hope not. Let's hope they're asymptomatic and it's just been picked up by testing. We don't know. We don't know yet. But the Prime Minister of Israel, we are currently on the verge of a state emergency. So one of the reasons I am so concerned is this sort of reaction has come from politicians all around the world who are, of course, advised by the very best people. And the politicians are concerned as a result of the advice they have received. Therefore, I conclude there is cause for concern. Belgium have got 1 case. Came from Egypt to Belgium on the 11th of November, which of course was when the first case was detected in Botswana. So in other words, this has probably gone. If it did start in Botswana, it had already gone from Botswana to Egypt in the days before that. So this means this probably started in probably the 1st of November or something, or even before that. How much has it spread around? Probably quite a lot already. This case in Belgium, first symptoms were on the 22nd of November. Now, they came from Egypt on the 11th of November. There's no Omicron cases in Belgium at this time. Therefore, this person must have brought it from Egypt with them, unless they picked it up from a very rare carrier in Belgium, but that's remarkably unlikely. So it looks like they had it then. So that means that the incubation period there was 11 days. Pretty long. Is this going to be a characteristic of this virus? We don't know. We don't know yet. Hong Kong. 2 cases. Apparently, one was transmitted from a next door neighbour in a hotel quarantine. Was a traveller from South Africa, so that looks like it came from South Africa. Now, back to a bit more information about the virus. Penny Moore, a virologist at the University of Witwatersrand, Johannesburg, doing a lot of the provisional work on this. Breakthrough infections have been reported following Johnson & Johnson vaccine. Breakthrough of infections have been reported following Pfizer-BioNTech full vaccination. Breakthrough infections have been reported following Oxford-AstraZeneca full vaccination. So there are, we don't know how many, but we know that there are breakthrough infections after all 3 of the vaccine types used in South Africa. So far the R value is 2, doubling times about every 2 weeks at the moment. South African National Institute for Communicable Diseases, there was 2,465 cases yesterday, nearly doubling the day before, the number the day before as we saw there. So a sharp increase on the day. And we will be waiting for tomorrow's figures with interest, of course, but we can expect another similar increase, I'm afraid. 32 mutations on the spike protein, 10 on the receptor binding domain in this Omicron mutation, in this variant. So this is a lot different. Now, because the spike protein, because all the vaccines make spike protein, and there's now 32 changes, 1, 2, 3, 4, 5, 6, up to 32 changes on the spike protein. The spike protein is now a different shape. So if the spike protein was this kind of shape before, particular shape that's recognized by the immune system, now this shape could really be quite different. It really could be quite a different shape, and that probably won't be recognized. The antibodies that are designed to fit into this probably won't fit into that, at least as well. And of course this also means that the monoclonal antibody treatments won't be as effective either. 10 of the mutations are on the receptor binding domain. Now, as you remember, if this is the cell here that's going to get infected, that's the ACE2 receptor site there, and here's the spike protein that comes along to fit into that. The receptor binding domain is the bit of this spike protein that actually binds onto the receptor site. And there's 10 changes in the receptor binding domain. And it looks like these changes are making it fit into the ACE2 receptor site more readily, because it's more transmissible. And we don't know yet, but it could be that the individuals are producing much higher numbers of viral load as well. More to learn on that. Now, so 32 mutations, 10 mutations on the receptor binding domain. By way of context, the Delta variant has 8 mutations on the spike protein. The Beta variant in South Africa, the old South Africa variant, which was outcompeted by the Delta, has only got 3. So we're dealing with 32 mutations, up from 8. This is a very different shaped spike protein. And of course the vaccines were designed to work on the spike protein. Younger people appear to be contracting and spreading the disease. School-age population, young adult population seem to be spreading the disease. Are they getting sicker from this than they would have done from the previous variant? We don't know. But there's certainly been a lot of contagion in younger age groups. Pfizer say they need 2 weeks to assess the variant's new impact. We'll need 2 weeks at most, so they'll do it within 2 weeks, to assess how well the coronavirus vaccine works against their new Omicron variant. And they say may require an adjustment to our vaccine if the variant spreads globally. Now, the Oxford AstraZeneca, the Johnson & Johnson, the Pfizer and the Moderna can all tweak their vaccine fairly readily to fit a new type of SARS coronavirus 2. Why they haven't done that already for the Delta variant, I don't know, but they haven't. They must think the other vaccines are good enough, or they can keep selling the other vaccines. They don't need to produce a new one. But if this is quite a lot different, as this would suggest, if it is quite a lot different, they can make tweaked vaccines which will be much more specific for the B11529 Omicron variant. Now, how are we doing with global spread? Well, the World Health Organization advises risk-based scientific approach to travel restrictions, which sounds good. Same as motherhood's a good idea and apple pie tastes nice. Risk-based and scientific approach to travel restrictions. Again, who could disagree with that? But WHO spokesman, this guy, said at this point, implementing travel restrictions is being cautioned against. In other words, the World Health Organization is saying don't introduce travel restrictions. Now, what do we think of that? No, I think they're wrong. They are waiting to see, and by that time this variant will have spread all round the world. We don't have the time to wait. Have they learned nothing from the original spread? When on this channel we were saying stop the flights out of China way back in February 2020, and the World Health Organization was saying no, carry on flying in and out of China. Unbelievable, complete lack of proactivity, resorting to reactivity. hard to believe. We need to buy the world a bit of time, and if that means a few passengers are inconvenienced travelling back from South Africa, then I'm afraid so be it. We need time to prepare for this. UK, however, has banned flights. Now, 700 arrivals a day from South Africa. Now, the flights didn't stop till about 12 noon today. So quite a few people have arrived from South Africa today in the UK. Of course, they've been asked to self-isolate. Of course, they've been asked to do 2 PCR tests. Will they all do it? I don't know. They don't have to go into hotel quarantine. I think it's till next week. So they've just gone home. And of course, they've been flying for the last 700 people a day for the last few weeks from South Africa. South Africa, Namibia, Lesotho, Botswana, Estrana and Zimbabwe, again, we've banned flights from all of those countries, so I agree with that. They need to suspend these for now. Recent arrivals from Southern Africa will also be tracked and offered tests. So all these 700 a day, 700 that arrived on Thursday, and the 700 that arrived on Wednesday, and the 700 that arrived on Tuesday, and the 700 that arrived on Monday, and the 700 that arrived on Sunday before that, they all need tracked down. Is Test and Trace capable of doing that? I really don't know. So if you have just come from South Africa to any other country, please self-isolate until you get negative PCR testing, and seek PCR testing as soon as possible. It's got to be PCR testing so there can be a genomic analysis. So anyone listening who's just come from South Africa, just please do that for the next few days, and we can slow the spread of this thing down by a month, hopefully. Maybe more. Germany, Italy, Israel, Kenya, Singapore, Japan, France, Bahrain, Czech Republic have also suspended flights. Good. European Commissioner calling on all member states to do so. Sajid Javid, Secretary of State for Health. Very lively discussion about adding to the red list, so that looks like it's going to get bigger. Professor Danny Altman, immunologist, Imperial College London. We thought the Delta variant was dominant, the dominant variant, and nothing could displace it. So we had thought that was as bad as it was going to get, but we were wrong. This looks potentially horrible enough to displace it. If it's allowed to spread, and according to the World Health Organization, you can carry on flying, so I guess it will spread. Although, thankfully, individual nations and the European Union have taken cautions. The states have not, as we'll see in a minute. We have all become pandemic fatigued, and yet if this was a report of a terrorist threat, we would now be raising the threat level from amber to red. So we're on red alert. Everyone's fed up with it, but the virus doesn't care about that. A professor at McGill University, this is what happens when we leave 3 billion plus people unvaccinated. Of course. And the vaccines can be tweaked if needed, but it's a pity that's going to be needed. Dr. Anthony Fauci, flight ban is possible. For goodness sake, ban the flights now. Give us a month to get this sorted. What are they playing at? Proactivity. Let me just explain this to world leaders. Proactivity means thinking ahead of time. You know, if you don't understand the word proactivity, it means to think ahead and to anticipate problems before they come and land on your head. What bit of proactivity don't they understand? We need to get the facts. Well, of course we do. An apple pie tastes nice. No indication it's yet reached the United States. Well, I suspect it has. The fact that you have no indication of it means it probably means nothing. I mean, it probably has, because the genomic testing in the States is low. New variant is a red flag, Dr. Fauci concedes. Until it's properly tested, we don't know whether or not it evades the antibodies that protect you against the virus. Let me tell you, Dr. Fauci, from the evidence I've already presented in this talk, it clearly does, I'm afraid. Time to stop the flights and buy the United States a month or two to prepare. But it's not happening.